Yay, thank you so much for that introduction. Yes, I am Kendall, and I am thrilled and honored to accept the Henry McMahon Children's Mental Health Award. If I'm completely honest, I feel a little imposter syndrome. When I was asked about this opportunity, I said, well, I don't think of myself specifically as a children's mental health advocate. I mean, I do serve on the board of the Austin Child Guidance Center, and I am so honored to serve as their Voices for Children Giving Society chair. I've also had the pleasure of serving the National Alliance on Mental Illness, NAMI Central Texas, as their walk chair, and on the Dell Children's Trust, and a few other volunteer endeavors. But I don't think I specifically thought of myself as a children's mental health advocate, because this just seems as part of my payback and part of my ongoing journey and part of my appreciation for where I've been and where I've come. You see, as a child, I was diagnosed with depression myself. I saw therapists on and off throughout my life, received the help of mental health professionals to learn some tips and tricks and tools to get through some challenging times. And unfortunately in college, after my grandmother got diagnosed with Alzheimer's and my mother got diagnosed with colon cancer and my father passed away unexpectedly, I ended up hospitalized in the psychiatric facility at the Georgetown University Hospital. But that isn't a bad thing, and it's not negative. It is, in fact, uplifting and a story of hope and resilience, because I am here today. And I would say there's a happy ending, but it hasn't ended yet. I'm still going. And I know that all of that is due to the resources that I received, to the people that were advocating for me when I didn't know it, to the support system, to the professionals, to friends and family, to those who didn't think I was weird. And so thank you. Thank you to all of those people. Thank you to the ACGC, to NAMI Central Texas, to those who are allowing me to continue on my own journey to give back in appreciation. And I just really want to say thank you to the Kids Living Well partnership. And these times of division, we need more collaboration, more unity, more people coming together with good ideas to provide holistic wraparound services, to meet children where they're at, to truly see them so that every child is known where they're at. And really that we're talking about mental health and practicing good mental health habits in good times. That way we're ready for them in some of the challenging times. So thank you to all of you all for doing that work. Especially thanks to Henry McMahon for his legacy, for his leadership, and for his spirit continuing to guide many of us today. And then lastly, a note to my kids and/or to the parents and caregivers out there. Let us keep talking about feelings. We've been said in our family that we have big feelings, and the Antonellis feel really big. And I love that. I love that about myself. I love that descriptor when teachers say that about my kids, because it means we're talking about our feelings. We sit down at the dinner table at night, and just as the same as we say, what'd you eat for lunch today? Because we all know that that's one of the only questions that our kids answer after school. But we also say, how'd you feel? What are the different feelings you felt today? And so I hope, kids, that we can always talk about how we feel, and it can be an exciting and a beautiful thing. And we talk about how we feel when we feel good, and we talk about how we feel when we feel bad, or when we feel angry, or when we feel mad. And then sometimes just talking about it helps. Sometimes it doesn't, but there's other tips and tricks we can do. We can go color, we can get outside, we can play sports, we can go for a swim. And so whatever it is, let's just talk about how we feel more. If I can do anything, I'd love to offer up a mantra that we have in our house, and that's no stigma in my house. Because the truth is, what is so challenging about mental health is we often only think about it when we're in those difficult times, but we all have it. We have mental health. Right now, I have mental health. You have mental health listening to this. Maybe it's good mental health. Maybe you're going through some challenging particular times, but we all have it, every one of us. And those challenging times can make you feel like you're alone, and they can isolate you and make you feel like you're the only one. And that's what's tricky about it. But just know that you are not. You are not the only one. Everybody, there are so many people around you to support you, to provide you with services, to help you walk through your journey. All of our journeys look different, and at the same time, there's so many of us who've gone through them. So just know that you are loved, you are seen. Let's talk about our feelings, and let's make sure that when we go home at the end of the day, or in this virtual world if we're still at home, that we say no stigma in my house. Thanks, Sal.